it's CJ. Today I'm going to tell you the 5 most common symptoms associated with Group B Strep during pregnancy. And if you stick around, I will also let you know what you can expect if your culture comes back positive. Number 1, and this is by far the most common symptom of all, no symptoms whatsoever, which is why it is really important to get screened between 35 and 37 weeks gestation. The screening test is actually really simple. Your provider's going to take a Q-tip. It looks like this. They're going to swab your vagina and your rectum, or they will give you the Q-tip with some instructions regarding self-collection. They'll send the swab off. It takes about 2 days to get those results back. Number 2, urinary tract infection. If your culture comes back positive for Group B Strep, they will treat your urinary tract infection. However, you will then be considered a carrier. The good news is you will not need to be tested between 35 and 37 weeks. However, the bad news is you will need to be treated in labor. Number 3, an increase in your vaginal discharge, which is actually a really common normal symptom of pregnancy. However, if it is accompanied by number 4, persistent pelvic pain, that might be due to Group B Strep and something you need to talk to your provider about. And number 5, preterm labor. If your cervix is dilating prematurely before 37 weeks in the presence of contractions. If your Group B Strep test was positive. If you had Group B Strep in a urine culture at any time during your pregnancy. If you are in preterm labor, your provider will most likely recommend treatment. Treatment involves getting an antibiotic through an IV. The antibiotic is not for you, it is for your baby. Your baby's immune system is not equipped to handle Group B Strep, and if you give birth vaginally, there is a chance the baby can come in contact with Group B Strep, and for a very, very small number of babies, they can get an overwhelming infection that can be life-threatening. I do hope that this information has been helpful, and that if you have any questions, you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.